Hi, my name is Dr. Megan Davis, and today I'm going to talk to you about One Health, global health, and antimicrobial resistance. Briefly, I'm a veterinarian trained at the University of California at Davis. I was in full-time practice for 7 years, including a number of years in dairy and mixed practice with Amish and Mennonite dairy farmers. I earned my Master's of Public Health and my PhD in Environmental Health Engineering from Johns Hopkins Bloomberg School of Public Health, and I've been on faculty since 2014. Shown here are a number of my students who do a lot of work in One Health. One Health is really a very interesting discipline that has been growing in interest among various organizations, and the American Medical Association and American Veterinary Medical Association partnered a number of years ago on the One Health initiative. And because of this, it really has brought together a lot of physicians, veterinarians, and additional scientists to try to work on problems that are amenable to One Health solutions. So you might wonder what technically is One Health. And the AVMA One Health Initiative Task Force defined it as a collaborative effort of multiple disciplines working at various levels, including globally, to obtain optimal health for people, animals, and the environment. And so if you were to draw a Venn diagram, as I have here, of what One Health is, it's the place where human health, animal health, and environmental health come together. And this is not to say that any initiative that would look at just zoonotic disease between humans and animals would not be important, but it really highlights the critical role of the environment in these efforts. It's an exploding field of study, not just for research, but also for programs and policies. And here I have a graph that shows the number of publications, and you can see that it really has exploded in the last decade. I've been involved in various initiatives to try to standardize One Health tools and One Health methodology. And one of these is the checklist for One Health Epidemiologic Reporting of Evidence, or COHERE. COHERE is a lot like PRISMA or STROBE or CONSORT or REFLECT. It's a guidance document to help harmonize and improve the reporting on various One Health studies. I've applied this to a number of studies, including those in antimicrobial resistance. So let's talk about that. Antimicrobial resistance has a large global burden, but it's not well quantified. Recently, the World Health Organization launched the Global Antimicrobial Resistance Surveillance System to try to improve the quantification. You might give an example that there are an estimated about 500,000 cases of tuberculosis that are multi-drug resistant, and these are estimates from 2014. Multi-drug resistance and drug resistance generally is important because it tends to lead to higher morbidity and mortality. So a human who comes in with a resistant infection may need several days before the physicians understand which antibiotic will work against the infection. And these delays can lengthen hospital stays, cause people or animals to become more sick, and they may die at higher rates. Critically, from a global perspective, humans and animals can carry resistant bacteria across borders. Antimicrobials themselves are drugs. They're chemicals that either kill or inhibit the growth of certain microbes. They may be bactericidal, where they actually overtly kill the bacteria, or they may be bacteriostatic, which means they hinder the growth of bacteria and rely on the host's immune response to help clear what bacteria remain. Antimicrobials are found in nature, so antimicrobial resistance can be found in nature. Some of these chemicals are produced by fungi or other bacteria. Traditionally, we've thought of this in kind of a germ warfare perspective, but these chemicals may also be important to interspecies communication at very, very low concentrations. So the dose may make the poison. Antimicrobial resistance depends on your perspective. For a bacterium, it's really quite remarkable. It's the ability to survive in the presence of one or more of these chemicals. But of course, for humans or animals, it might not be a good thing because the resistant pathogen is not necessarily going to respond the way we expect. So uses of antimicrobials can contribute to the selective pressure that can expand populations of resistant bacteria. And here's where I like to think of this as a resistome concept. The resistome is all the genetic determinants of resistance that may be present in a community of organisms, however that resistance arises. So if you have many different genes that are present in that community, then there may be a lot of diversity and ability for that population to evade killing by these antibiotics that we might use. We also have to remember that it's not just the pathogens that may be resistant, but even good or commensal bacteria that can be very helpful to humans and animals can carry genes for antimicrobial resistance and can express the phenotype of antimicrobial resistance. This can apply in animal, human, and environmental reservoirs. One of my collaborators, Dr. Ellen Silbergeld, likes to think of this as cloud computing. Now, I don't think it's as easy as just being able to download the gene when you need it, but certainly if you have a certain resistome present in a community of bacteria, it means that it may be possible for other bacteria that don't currently have a gene to be able to connect with bacteria that do have a gene and for that transfer to take place. And that can happen directly. So bacteria can actually share genes through plasmids or other horizontal gene transfer. They can also become infected by bacteriophages that may transfer some of these. Antimicrobials are important from a One Health perspective, in part because they are used not just in humans and in domestic or companion animals, but also in domesticated food-producing animals. And a lot of times we may use them therapeutically, just as a physician may prescribe an antibiotic to a human. This would be in the context of a veterinary client-patient relationship, or VCPR. But in addition, there may be uses outside of traditional treatment approaches. And so sometimes we in veterinary practice may have preventative uses that we want to use. So these would be in animals that are not sick, but we know that they have been, or we suspect they have been, exposed to an infectious agent. Finally, there are additional uses for growth promotion or feed efficiency. These have many different names. Many different people will use different names preferentially. So you may see them as economic uses, production uses, or GPA, growth promoting antibiotics. Historically, in the United States, where I'm located, this could be up to 80% of the uses that we had. And this is because a lot of times people could purchase them outside of a veterinary client-patient relationship. And if they suspected that their animals might get sick based on a stressful event, they might just go ahead and use them prophylactically or preventatively. Or they may notice that the antibiotic uses led to faster weight gain. And so those are really the uses that we mean with GPA. Countries have different standards for veterinary prescribing, and in many cases, these uses can be over the counter. And so it's not necessarily easy to tell which uses are therapeutic, which are preventative, and which are growth promotion. But from a systems perspective, any of these uses can select for populations of bacteria that are resistant. And so here I have a schematic that shows uses in chickens, and this is just an example. The uses can be in many different species. And here I've shown factors that can maybe increase the potential for use, such as animal proximity to waste. So there are constant exposures to fecal material and therefore the microbes that may be in feces. And then stress and crowding and other animal host factors may increase the potential use of antimicrobials in these poultry populations or chickens. The chickens then will ingest the antibiotic, and that will select for more resistant pathogens and non-pathogens in their gut and maybe elsewhere. And they will then defecate and shed these resistant pathogens and non-pathogens into the environment. And so then these genes may be spread through poultry waste. And when that litter or poultry waste is applied to fields as a fertilizer, you can also spread some of these resistant organisms and resistance determinants, the genes, into that environment, which can expose humans who live in the community. And that can be through water, air, or dust kicked up in the air. In addition, we transport chickens to slaughter, and there may be workers who are exposed in that environment. And then those food products are shipped back into human populations. And again, this can be an important route of human exposure. So I like to think about how we intervene. And you might assume that just reducing use would be a good idea. And the answer is that's generally true in both humans and animals. But sometimes there can be unintended consequences, and animal disease can become more prevalent when you reduce the uses of antibiotics and you don't change other factors. So one area that's been of real interest is how we can use animal vaccines to combat antimicrobial resistance. You may have heard of this on the human side as well, how if we can prevent, for example, a strep throat or strep pneumoniae, that we are not going to need to use as antimicrobials to treat the infection. And so that's true in animals as well. So if you have an animal that has a disease and you can use a veterinary vaccine to prevent that disease, then that will also prevent use of antibiotics and could also prevent contamination with a pathogen that might cause disease in food for human consumption. And so this has been just a brief introduction into how antibiotic resistance, global health, and One Health all come together. If you're still scratching your head, please feel free to reach out to me by email at mdavis65@jhu.edu. And thank you for your time.